This is Alex Shepley for class 156. I'll show you around the room. This is Emily. Emily, do I have your consent to record?
Yes.
Alright. Okay, before I enter the patient's room, I will check her chart to look for any allergies or any diagnoses that would interfere with my assessment. After that time, I would gather all my equipment and knock to enter the patient's room. When I enter the patient's room, I'll wash my hands and greet Miss Emily. And then I will explain to her that I'm going to do a head to toe assessment. It'll take about 10 to 15 minutes. Is that okay?
Yes.
Can you state your full name for me?
Emily Renee Greathouse,
And your date of birth?
March 21st,
Check your
1996.
ID bracelet. Looks good. At this time, I will check her vital signs. I'll check her temperature, her pulse, her respirations, her blood pressure, and if she's in any pain. Are you in any pain?
No.
Okay. So after that, I will start my assessment by her level of consciousness. So, as you've already stated your name, do you know where you are?
At the hospital.
And what's your reason for being here?
Just to check up.
Okay. And do you know what today is?
August 14th.
Alright, so I'm going to start with your hair. I'm looking for any rashes or lesions. Your hair is thick, it's evenly distributed. And then I'm going to move down to your eyes. Could you sit up for me? Thank you. Turn the light off. I'm going to check her pupils. Go here. Perfect. Can you look at the tip of this pin? And then at that wall? And then back again? One more time? Perfect. My patient is alert and oriented times 4. Her pupils are equal and reactive to light and accommodation. So her eyes have no sign of redness or jaundice or drainage. Look at her ears now. There's no sign of blood or serum buildup on either side. Can I have you tilt your head back and look at your nose? Perfect. Can I take can you cover one nose and breathe in for me? The other side, please. A little congestion. I will make a note of that in my chart. And then can I have you open your mouth for me? Great. Her lips look moist. Her tongue is pink. She has all of her teeth. There's no mucus or anything in her mouth. Okay. Now we'll check her carotid artery on one side, and the other. We'll take a listen. I felt no thrills in her carotid artery. We'll take a listen. No sign of any buoys in her carotid artery. So now we'll do some range of motion on your neck. Take your chin to your chest, please. And then up. And take it to your left shoulder. The other way. And then turn your head. Perfect. The other side, please. Thank you. I'd also be inspecting her skin at this point. Check for any rashes, lesions, bumps, or edema. Check the symmetry of her face. Her eyes look equal. Ears, nose, and mouth. Everything looks good. So now we'll. Can you take a deep breath for me? And now, chest rises in symmetry. Now we'll take a listen to her apical pulse for 1 minute. Okay. The rhythm is normal. and it's about 80 beats a minute. So now we will go to an arm. I'm gonna do some range of motion, rip it up, down, flex it, up, down. Okay. I'm gonna check her other arm for that, and then her radial pulses bilaterally. That's good. Her skin is warm in her arms. Can you hold your hands out like this for me? Checking cap refill for less than 3 seconds. That's great. Alright, so now we'll listen to her lungs. Take deep breaths for me. Okay. Respirations are at 12 respirations a minute. Can I have you lean forward for me? I'm going to look at her spine for any signs of scoliosis or sarcoidosis. And then I'm going to listen to her back, lungs, in all 6 points. Okay. Can I have you lay down for me? This time I checked for her abdomen for any rashes. Are you having any stomach pain? Okay. So now I would listen for her bowel sounds. Listen in 4 quadrants. For up to a minute at a time. I will do light palpitations and ask her if she's in any pain.
I'm not in any pain.
Okay. Okay. Now I check her pineal area, look for any rashes or lesions or discharge. When was the last time you voided?
2 hours ago.
In your last menstrual cycle?
2 weeks ago.
Okay. Was there any pain when you urinated?
No.
Or burning?
No.
Okay. And then at this time I'd have her return to her side, inspect her rectal area, look for any hemorrhoids or lumps or lesions, and ask her about her last bowel movement, which was yesterday. Okay. And then we'll move down to her legs. We'll check her femoral artery, her popliteal, her ankles down here, and your feet up here bilaterally. And then we'll do some range of motion. Bring it up. Perfect. And I'll assess your foot strength. I need you to push up against my feet. Perfect. And down. Perfect. And we'll do cap refill on her toes. That's great. Can I have you squeeze my hands? Perfect. Is there anything else I can do for you today?
No, that's okay. Thank you.
Alright, so I would make sure her call eye is in place, wash my hands, document, and report any equipment that was used or found.